Welcome to Mental Health and Science with Birabi Enock Francis. In today's video, I'm going to show you how to differentiate between fainting or something which is similar to epilepsy, but it is not epilepsy. Okay? So in front of me, I have these two people. They are acting or demonstrating what happens in the clinical room. So we have, this is the patient, and this is the brother who has brought this patient in the clinic. So I'm going to demonstrate how this happens and the difference between epilepsy and those other things which are similar to epilepsy. Okay? So, good evening, sir.
Good evening to you.
How are you doing?
Fine, and you?
What's the problem with our sister?
It follows down.
It falls down.
Yeah.
When did it start? Oh, how many months has it taken?
3 months ago.
3 months. Okay. So when it comes, does it just fall anyhow or she shakes the body? It just falls.
Yes.
Okay. Rose. Okay. So what happens is these other sicknesses which are not like epilepsy, when you try to interact with the patient always collapses. Okay. And most of these patients are young adults, like some like 12, 15, 12, 14 years. So when you're trying to interact with them, they always collapse. Okay, like you want to get more history, like a health worker, you find this person collapsing in a what? In a clinical room. Okay, so I want to get more history from her. Rose, how are you? Okay, so when you try to ask, the patient is always collapsing. So what does that mean? This is, you may not be dealing with what? With epilepsy. Okay? So I want to show you in another video or in another person who is showing us what really epilepsy is. Okay? So I'm going to use another individual who is not a client, but I want to show you what really epilepsy is and what it does. Okay? So imagine this is our patient, but it's not a patient and is having convulsions. So when he's convulsing, there is always it can be one side of the body which is convulsing, or it can be both sides of the body which are what? Which are collapsing. That one, just know that epilepsy follows a certain pattern. Okay, if he's shaking one side of the body, it will be one side of what? Of the body. Or if it is two sides of the body, it will always be two sides of what? Of the body. Okay? Then let us show you another type which is not epilepsy. Okay? So this time, the person can fall anyway. So he's falling this side, he's falling the other side, any direction that he falls, and this time we are not seeing anything like convulsing. Okay? So how can we differentiate between the two? So epilepsy always follows what we call a specific pattern. Okay? If it is one side of the body which is shaking, it will always be one side of the body. If it is both sides of the body, whenever a person falls in any way, on the road, on the bed, it is always all of these hands. But in the case of our client that we had, when you try to interact with her, she only collapses. So children of that age, there's a way how they communicate. They don't know how to express themselves. So sometimes they may need something, but maybe the parents has refused to give them that thing. Then they keep on fainting. Every time this child faints, and when they rush them to the hospital, you may think you are dealing with epilepsy, but it's not epilepsy. And why? Because these children can fall anyway. So this is something which is linked to the brain. You may find that this patient of mine is unconscious, but it is a way of communication. So that is how we can differentiate between epilepsy and something which is similar to epilepsy. If you like this video, please I request you to subscribe that on that button there, because it motivates me to make more videos. And thank you so much for watching. See you in my next video.